Okay, well, firstly, I would like to thank the Brain Foundation and all of the donors for this award and for seeing some value in this research. So I conduct my research at Airport Hospital and Monash University at Melbourne. And my research specifically investigates traumatic brain injury, which, as some of you may know, is still one of the leading causes of death, disability, and hospitalizations worldwide. Moderate and severe TBI accounts for about 30% of all these injuries, and often they result in ongoing adverse cognitive, behavioral, and psychiatric outcomes. Now, these same individuals also experience a transient state of post-traumatic amnesia following their accident. And this period is really characterized by an inability to form new memories and also by confusion and disorientation. And importantly, this period of time, or post-traumatic amnesia, which can last between minutes to months, has emerged as one of the strongest predictors of the severity of injury and longer-term outcomes for these individuals. And although now PTA is being used worldwide for the diagnosis and prognosis of these patients, the guidelines regarding the management and expectations of these patients within this period are largely based on clinical experience. However, systematic research studies are lacking that detail the cognitive and neuropsychological aspects that occur during this period. And there's been relatively sort of no explicit investigation of the mechanisms responsible for the initial memory disturbance in this period, or the resumption of normal memory following TBI. So treatments during this period of PTA comprise only essential sort of interventions. So really the monitoring of the depth of PTA, some physiotherapy, and some basic speech therapy as well. However, the viability of other interventions, whether they be behavioral, occupational, or cognitive, are limited, as it isn't known to what extent patients can process and retain new information. So in this current project, we propose a world-first study which we think will add sort of critical information by looking at a novel prospective functional MRI of individuals in this period of post-traumatic amnesia and the recovery of function over time. Yeah, thank you.